This is a tour of the maternity unit at Harrogate and District NHS Foundation Trust. We plan to take you on the journey through the department from arrival at the hospital to discharge home and answer any questions along the way. Harrogate is a district hospital that is friendly, clean and smaller than other regional hospitals. We provide high quality personal care that is women-centred and individualised in its approach. We have a close multidisciplinary team, and this is the reason why we are first choice for patients. Our aim is to provide a calm and welcoming maternity unit where you and your family will receive safe, high-quality care throughout pregnancy, childbirth and postnatal period to aid the transition to parenthood. We wish to facilitate a positive birth experience in a sensitive, supporting and friendly environment. All staff working within the maternity unit will work closely with you to plan care that is appropriate and realistic to your individual needs and wishes. We hope this tour will provide you with all the information you require. If not, please contact your named midwife. The maternity department is situated on the ground and first floor of Strayside Wing at the Harrogate District Hospital. There are two ways into the hospital, either through the main entrance of the hospital, this is open all day and night, or through antenatal entrance. From the main entrance, to get to the maternity department, walk along the main corridor to the end. Turn right and walk to the end of this corridor, and the antenatal clinic and the antenatal day assessment unit are on the right-hand side. Most pregnant women will be seen by a named community midwife in either a GP surgery, the local children's centre, or in their own home. Women who require care by an obstetrician will be seen in the antenatal clinic, where a plan of care will be developed. They are consultant antenatal clinics during the week, Monday to Thursday, and a combined medical antenatal clinic on Wednesday mornings. The antenatal day assessment unit is situated in the antenatal clinic and is available for women who are experiencing reduced fetal movements, pregnancy-induced hypertension and obstetric cholestasis. Midwives are available to provide advice, guidance and information on screening tests during pregnancy, counselling about screening and diagnostic testing. This also includes a discussion on newborn screening. The day unit is open Monday to Friday, 9 AM till 4:30 PM. The other way to the unit is through the entrance near the antenatal clinic. You can enter this door between the hours of 7 AM until 10 PM. After this time, you will need to use the main entrance at the front of the hospital. You can park your car in the main car park in front of the hospital. There is a charge per hour for this. Delivery suite and panel ward are situated on the first floor of Strayside Wing. Go up to the first floor, either use the lift or the stairs. When you reach the first floor, turn right and the maternity unit is on the left-hand side. There are vending machines available to buy snacks, situated on the right-hand side of the corridor, just before you reach the entrance to the maternity department. There are always wheelchairs at the front of the hospital, and if you are in a lot of pain, please use one. The hospital places great emphasis on infection control and hand hygiene. Please clean your hands before you enter the department, and when you leave, please ask your relatives to do the same on entry and leaving, as it prevents cross-infection. When you arrive at the maternity department entrance, you will see there are 2 buttons. The one to use when in labour is the delivery suite button. You must always press the button before you go in.
Delivery suite, can I help you?
Never follow somebody in at the same time, as this is a security risk for you and your baby. Please inform your relatives and friends of this security measure. Also, please be patient. The ward staff will answer the button as soon as possible. The hospital cannot accept responsibility for your personal belongings. Please do not bring expensive items into the maternity unit. When you are admitted to the unit, you or your partner on your behalf will be asked to sign a disclaimer form saying that you accept this responsibility. For partners, visiting is unlimited between 8 AM until 9:30 PM at night. We encourage the mothers to rest between 1 PM and 2 PM and have protected meal times. Please try to arrange your visits around these times. All other visitors are welcome between the following times: 2 PM until 4 PM and 6 PM until 8 PM. These visiting times are different from the main hospital. Please note, no children under 16 years old other than your own are allowed to visit the department. Your own children can come with Dad at the times mentioned earlier. As you enter the maternity unit, the door to the delivery suite is on the right. Don't forget to use the hand gel prior to entering. You will be met by a member of staff who will show you either into the assessment room, a delivery room, or the observation room. The assessment room is where you will be assessed to see if your labour has started, or whether you may need to be referred for further assessment. For example, monitoring your baby's heart rate. If you are not in established labour and all is well, you will be advised and encouraged to go home, as we do not have facilities for expectant mums to sit and wait for labour to commence. It is a good idea to be at home, as it is much better to be in your own environment with the knowledge that you can come back to the hospital at any time. Make sure that you have someone to support you during this time if you require it. Please phone the delivery suite before you leave the house. This ensures that the staff are expecting you. There are 5 delivery rooms and a pool room on the unit. We also have a dedicated low-risk room. This is for women with very straightforward pregnancies and labours who require little intervention and very little pain relief. We encourage mums to be mobile as much as possible throughout labour, and we do have some birth aids, for example the birthing balls. We encourage all women to write a birth plan during pregnancy. The content of this should be discussed with your named community midwife prior to the onset of labour, around 36 weeks. This allows the professionals caring for you to know your wishes and understand your individual needs. It is good to make plans, but please remember that every birth is different and the course of labour is unpredictable. The most important thing is to keep an open mind. Each room also has a cot available. Comfortable chairs or recliners are also in each room to enable you or your birth partner to sit or rest. Every room has a television and a phone service that you buy cards for. Every room has a music system so that you can bring your own choice of music to help you through your labour. This may be something that you have listened to and have enjoyed whilst being pregnant. Each room also has a call button, which you can press anytime if you require a member of staff. There are en-suite facilities in each room for patients only. These are shared with the room next door. Staff will demonstrate the process of locking the door when you want to use this facility. The rooms also contain some equipment. The CTG machine. This is used to monitor the baby's heartbeat and record contractions. Not all women require continual monitoring, and you will be assessed by the midwife to see if this is required. Piped gas, called Entonox. For many women, this is used more in the later stages of labour. Be reassured, it is provided from a central supply system that never runs out. Every room has a resuscitator, as some babies, when they are delivered, require oxygen and suction. It may be wall-mounted or freestanding unit. In the event of an emergency or mums requiring some assistance with the delivery of the baby, we have an operating theatre on delivery suite. If you are having a planned caesarean section, your care pathway will be slightly different and you will be admitted directly to panel ward, and your caesarean section and the birth of your baby will take place in the main theatres. Water is one of the best forms of pain relief. It provides a very natural experience. You can use the pool for pain relief and birth. The water is regulated to a comfortable temperature for you in the first stage of labour. It is regularly checked by the midwife to body temperature during the second stage. You can also use Entonox whilst in the pool. The pool room has a hoist in the event of you needing to be supported out of the pool at any time. We have clear criteria for the use of the pool. Pregnancy and labour must have no complications, and labour must be established. Please discuss this further with your named midwife if you require more information. When do you have to express an interest in the pool? When you ring in, just say that you would like to use the pool and the midwife will tell you if it is available. In our observation bays, there are 2 4-bedded areas which are used when women require care but are not in labour, or if require induction of labour. We often use some of these beds for mothers who choose to go home early within our 6-hour discharge. In the event of your baby requiring extra support and care after birth, we have a special care baby unit which is connected to the delivery suite. If we are aware your baby will need admission to special care, we will try to ensure you either visit the unit or a member of staff from the unit will come and talk to you. How long do you stay on delivery suite after the birth of your baby? Depending on the mode of delivery, your stay can vary. When you have first delivered, your baby will normally be placed onto your chest. This is known as skin to skin. Your baby can be dried with a soft towel at the same time to ensure no body heat is lost. We encourage your baby to remain skin to skin for at least 60 minutes. You will receive more information about skin to skin at your 28-week antenatal appointment with your midwife, when the advantages of skin to skin are discussed and your views are taken into account. Skin to skin is very important for babies as this keeps them warm, regulates their heartbeat and breathing, and will also help in the initiation of breastfeeding. Your baby will then be examined and weighed by the midwife, dressed, and 2 name bands and a security tag will be attached to your baby's ankles. If these come off, please inform the staff immediately. If you or your partner would like to be involved in the dressing of your baby, please let the staff know. You may require further care. For example, if you have torn a little, then either the midwife or doctor will perform the stitches. This is done as soon as possible after the birth. Once completed, we will help you freshen up, make you comfortable and provide you with some light refreshments, normally tea and toast. Then we will leave you for a time to be a family, as it's very important to have some time together at this stage. Be reassured that the staff are always available and feel free to use the call button during this time if you need help or require advice. If you have had an epidural, we advise that you never get out of bed unless a member of staff is with you or you have been assessed that the epidural is no longer working. It is usually a couple of hours before we transfer you to the postnatal ward known as panel ward. We encourage mums to be discharged within 6 hours or earlier after delivery, particularly if this is not your first baby and you have the appropriate support at home. You will stay on delivery suite and go home from there. You won't need to go to the postnatal ward. This is the antenatal postnatal ward. It is an 18-bedded ward with a mix of bays and single rooms. We no longer have nurseries on maternity units because evidence and national guidelines recommend that baby remains with mum all the time. This helps with breastfeeding and helps you get used to the baby's cues, the signals that the baby is giving you, so that you know when your baby is hungry, hot or cold, or just wants a cuddle. Support and advice is always available from the staff on the ward, should you require it. If you wanted to have a single room for your stay in hospital, you can request one, but there will be a daily charge, and these rooms are known as amenity rooms. Please note, not all single rooms have ensuite facilities. Please discuss your preferences with the staff before giving birth. We cannot guarantee you an amenity room, as it depends on the number of patients on the ward at that time and individual clinical needs. If you request an amenity room, you will be asked to sign an agreement form and the invoice bill will be sent to you approximately 28 days after your transfer home. Please ask your midwife for further information. Women who have had a caesarean section, either planned or emergency, will spend the first 24 hours in the main bay, as this is a much safer way to observe patients and provide care. If you then wish for a side room, there will be a cost attached, and only if one is available at that time. There are various sitting areas on the ward, including the day room and the conservatory. The conservatory is a lovely area, especially during the summer months, for you to sit away from your bed. And you can bring your baby with you. We have a security system in place that restricts the movement of babies from the unit. All the doors are secured and a loud alarm is triggered if a baby is taken through the door with a tag in place. One of the name bands will have a tag attached to it, and this must stay on your baby until you both go home. This system is robust and will help prevent your baby being taken out of the unit without your permission. You will get a choice of food brought to you at your bedside. The menus are given to you in the morning to choose for your lunch and your tea. Breakfast is self-service and starts at 6 a.m. until 9:30 a.m. Cereal, fruit juice and yogurts are laid out in the dining room. Toast can be made in the kitchen and tea, coffee or water are available from our vending machines at any time. Most people, when they have their first baby, stay at least overnight. The reason being that you may require support, advice and reassurance related to feeding and looking after your baby. This support and advice in the early stages is crucial. Your baby will also have the baby check performed. The baby has a full physical examination by the paediatricians or midwife, which is done at the earliest 6 hours. This examination can also be performed at home by the community midwife if required. A hearing assessment will also be undertaken on your baby with your consent. If you decide to go home before the hearing assessment, you will receive a letter to attend an outpatient appointment to enable the assessment to take place within 2 weeks of your baby's birth. Mothers usually stay between 24 and 36 hours. If you had an operative delivery, for example a caesarean section, your length of stay will be longer, and this will be explained to you by the midwife on the ward.
Consider making a birth plan and discuss this with your midwife.
Always ring before bringing yourself into hospital.
Pack a bag for when you come into hospital.
Have a nominated contact for phone calls to the ward.
Have you thought of any coping mechanisms that you're going to use in labour?
Consider your options for pain relief.
Birth partners, remember to wear cool clothes and bring refreshments.
Consider whether your birth partner would want to cut the cord.
And don't forget your money for parking and for the phone.
If you've changed your address or planning to change your address in the next few days, please let one of the ward staff know before you go home.
Consider support for the first few days at home.
The community midwives provide care in the antenatal period from first contact between 8 and 10 weeks, right up to your admission to hospital in labour. They then pick up your care when you arrive home after the birth. They will make selected visits to your home up to 10 days post-delivery, but you will remain in her care up to 28 days post-delivery. If you require help or advice during your pregnancy at night after 20 weeks, please contact Delivery Suite, not your community midwife. The community midwives will provide advice, support and care both physically and emotionally for you and your baby, and provide you with sound advice regarding parenting skills. They will also undertake the newborn blood spot test when your baby is 5 days old. Please ask your midwife for more information regarding the screening test. There is always a community midwife on call for emergencies concerning you or your baby for the first 28 days after delivery. Many women choose to give birth in hospital, but we would encourage more women to give birth at home. If you would like to consider a home birth, our community midwives will be very happy to give you more information. We actively promote home births for women who have had an uneventful pregnancy and uneventful past obstetric and maternal health record. Please contact your named midwife for more information. Supervision of midwifery is a statutory framework that is in place to ensure the care you receive is evidence-based, safe, respectful and of high quality. The supervisors meet regularly within the hospital environment and also throughout the region to discuss any issues or concerns they may have with regard to practice and patient experience. They also meet on a regular basis to ensure that all midwives are safe to practice and remain updated and competent through regular professional development. We have several supervisors of midwives in Harrogate. There is a supervisor of midwives available 7 days a week, 365 days a year in the maternity unit. Please ring the hospital switchboard or access the Harrogate District Foundation Trust website. There is further information on supervisors of midwives on the notice boards in the antenatal clinic and delivery suite.
What do you think of maternity care in Harrogate
It's
Hospital?
been fantastic. I
Has it been
couldn't
okay?
have been more happy.
Oh, good.
Yeah, I've
So
had a
you're-
very positive
that's really
experience.
nice.
Yeah.
We look forward to seeing you soon.